Good day. I am Ishita Roy from Times Now and Health and Me, and today we are joined by Dr. Mrinal Gounder, an MSK physician and ambassador to India and Asia. He joined MSK in 2008 and specializes in sarcoma and other rare cancer. His expertise also extends to new drugs in cancer with specific focus on sarcoma. Since July is also the Sarcoma Awareness Month, there is nobody better than Dr. Mrinal Gounder to talk about all of this. His expertise also extends over 50 different rare types of cancers, which comes under the term sarcoma. And so today, we're going to talk about all of that with him, as well as discuss why sarcoma is also known as the forgotten cancer. Thank you, Dr. Mrinal Gounder, for joining with us.
Thank you for having me, Sheeta. I really appreciate it. And I really appreciate you taking the time and the effort to highlight sarcoma, especially at the Sarcoma Awareness Month. Thank you for having me.
All right, sir. So our first question is, what exactly is sarcoma?
Sure. So to ask, this is a pretty, first to answer your question is that it is an uncommon cancer. It's an uncommon cancer. Many people incorrectly think that sarcoma are benign tumors. There are some benign sarcomas, but the vast majority of sarcomas are malignant. In other words, this, if not caught early, if not addressed early, can spread and can impact your life in terms of mortality. There are infants who are just a few months old who can have sarcomas called retinoblastoma. If you have breast cancer, you know where to look. You're going to look in the breast. If you have lung cancer, you're looking for it in the lung. If you have colon cancer, you're looking for it in the colon. It tells you where these cancers are going to form. Unfortunately for sarcomas, you can get them from head to toe, from the very top of your head, from your scalp, to the hair follicles. The little hair follicle that comes out, you can develop a sarcoma called glomus tumors right in the hair follicle, all the way to the very tip of your feet.
What really causes it? Do we know the source of it?
Yes. So if you took 100 people with sarcoma, we think about 20%, these numbers are still being defined, but the data, some of the work that we did at Memorial Sloan Kettering, as well as other global studies, some from Australia and others, it shows that if there's 100 people with sarcomas, 20 of them may have a genetic predisposition that they may have inherited from their families or something they developed while they were still a little embryo in their mother's womb. So I think the two big things right now are some kind of a genetic predisposition, 1 in 20, and the remaining 80% is unfortunately just randomness. These are genetic gene changes that are happening in our bodies every day. Something goes wrong. Something small and trivial goes wrong, and the cell is not able to repair itself, and it becomes a sarcoma.
How do we then put it under the umbrella term? How do we come up that, oh, this is sarcoma, this is what makes sarcoma? And in terms of differences, how does it differ in symptoms, and how does it then differ in progression also?
Sarcomas are tumors or cancers that come from support the organs in the body that support all of those other organs. In other words, this is skin, it's muscle, bone, fat, believe it or not, fat, cartilage, and the list goes on, blood vessels. All of these other things are what we call a structural support. These are the things if you think of the analogy of a building, this is the entire building, right? The entire structure of a building. So if you're thinking about sarcoma, you're thinking about cancer, and you say, but I don't know what that is that I'm looking at in the scan, it's extremely important to refer to a surgical oncologist if one exists in the country, and there are plenty in India, of course, plenty of excellent ones. And they need to look at this and say, what is the best way to biopsy it? Because how you approach it, are you going from north, south, east, west, makes a huge difference in the type of surgery. You could cause more damage by having it biopsied at a local facility by someone who is not ultimately going to be the surgeon or the treating team. So if you're thinking something is not right, the scans look abnormal, the number one thing I would say is take a breath and pause. Don't rush to do something immediately because that can cause more harm. But once you do the biopsy, you have to have a pathologist who has expertise to look under the microscope and then to do whether a molecular test, genetic tests, to further say, okay, this is a sarcoma, this is a lymphoma, this is a carcinoma, what have you, to make that right diagnosis.
And when you do just a random Google search, a lot of people will tell you, eat this, eat that, this diet is anti-cancer or whatever. Also microplastics. I just want to talk about diet in general.
Yeah,
Is even organic diet a safe diet? Is anything safe at this moment? If not, then how do we then move forward? How do we go about it?
yeah. But before we talk about the diet, the one thing that I want to highlight is, I know we're talking about sarcomas, but one thing I want to highlight is there's been a huge drop in cancers in the United States in the last 3 decades. Huge drop. This drop is not because of fancy technology. It's not because of fancy, tests and things like that. It's simple tests like getting a mammogram, getting a colonoscopy, and and stopping smoking or chewing tobacco, right? Coming back to diet, that's a controversial topic, but I think I personally, as an oncologist, I say use common sense. Use common sense. And I think there's a couple of things that clearly show that are just not good for health. I mean, forget about cancer. They're just not good for health. They're not good for the gut microbiome. And I think things like highly processed, ultra processed food, carbonated sodas, any juices and things that come out of a bottle, that come out of a package, that have a ton of sugar, that there's very high level data that has come out of Sloan Kettering and many other places that show that these kind of foods, they change the bacterial content of the gut. Ultra processed things, things that come out of a package, anything that can sit in a shelf life for months on end, should really, I personally, in my own personal life, and I also tell my patients, try to avoid it. Try to, you don't have to be extreme and say, I'm never, ever going to touch it. Have it once in a while, use common sense, but don't get in the habit of constantly eating it because it does impact the gut microbiome. And I think what we are going to learn in 21st century is how important the gut microbiome as well as the skin microbiome is so important for human health. It's extraordinarily important for human health. And what I'm starting to find, at least from a food perspective, a lot of the data that's showing is that fermented food and green leafy vegetables are both very helpful for the gut microbiome. And I think the gut microbiome is extremely important for human immunology. And if you have a good immunity, you can prevent cancers, you can prevent a whole host of other issues as well.
Right. Yeah. And now, coming to India, you've also if I'm not wrong, in collaboration with AIMS, there was a project that was done, Project G1. So if you could just briefly walk me through it, I think it was focused on cancer trials in India.
No, thanks for highlighting this work on Project G1. This is really a fantastic collaboration between not just Sloan Kettering, but many pharma companies in the US with many thought leaders in oncology across India. It's not just AIMS. I think one of my co-leaders, Dr. Atul Batra, is at AIMS, who's co-leading it. But this is really a very large coalition that transcends institutions. These are like-minded people in India, in academic hospitals, in private hospitals, who are oncologists, ICMR, other regulatory agencies. So many people, similarly pharma companies, are all coming together to try to solve one problem, which is how do we increase the number of cancer clinical trials in India? So right now, when we're doing clinical trials, the vast majority of these trials are happening in the US and Europe, and in the last 10 years in China. China is becoming a huge, it's massively has made up the gaps that it had 10, 15 years ago. But the reality, it's not a pleasant reality, it's not a pleasant thing to hear, but India is severely lagging behind in terms of being part of the global ecosystem of cancer new drug development, right? So 1/5 of the world population, lots of cancer patients, but the participation in these new clinical trials, I mean, these are new drugs that are going to become the future drugs. And now you have access to these drugs very early on. And there's not as much participation that's happening in India as it's happening in the US, in Europe, Japan and China, and even other smaller countries like Taiwan and Hong Kong and so on and so forth. The question is why? And that's the main reason Project Jeevan is meeting. We meet often to hear what are the barriers, what are the challenges in India, what are the challenges from a physician in order to participate. What are the industry's challenges? When you have global industries, they come to India, what unique challenges do they face when they want to open a clinical trial in India? How can we address these challenges? How can we come up with proposals, and how can we solve this? We're writing papers. Right now, we're about to send out a paper that just focuses on the challenges that global pharmaceuticals face when they want to open a trial in India, right? And we're going to write that, but just writing a paper is not going to solve anything. Someone's got to take that, and our goal is to slowly chip away with this. Once we do this, next we say, how can we help physicians? They're so busy. They see 70, 80 patients a day. When they see so many patients, how do you have the time to do clinical trials? So what are the solutions we as a group, as thought leaders in our field, can come together and try to, including ICMR, from an informed consent process? How can they make things easier for patients? How can they make things easier for physicians who are treating these patients? And how can they make it streamlined for pharma company so that more and more Indian patients, whether you have cancer, whether you have heart disease, whether you have neurological disease, can take advantage of the explosion of science, the explosion of new knowledge and new drugs and new therapies that are happening in the world? How can Indians take advantage of what's happening in the rest of the world? And we're coming together. We're not going to solve anything, and this is a multi-year process. And we'll need private philanthropic funds to come support a lot of this work that we're trying to do. But this is not an MSKCC work. It's not an AIMS work. These are just like-minded people who are from PGI Chandigarh, CMC Vellore, from Zydus, from Apollo, from a whole host of hospitals from both US as well as in India, who are trying to come together and say, what can we do to change this scenario?
Also, I think this brings us to a very interesting, very important actually point, which Raymond and I were discussing earlier, that cancer, it is not a one fit for all sort of diagnosis or treatment. And I think this is, which is why clinical trials are also very important, like how it works on different bodies and all of that, which now I think very recently, if I'm not wrong, FDA has approved this T cell therapy on solid tumor like synovial sarcoma. Then how does it then sort of how does it differentiate from, let's say, earlier immunotherapies?
So I would say it's so when you say earlier immunotherapies, I think what you're referring to are classes of drugs known as checkpoint inhibitors. Yeah. And this could be something called PD-1 inhibitors, PD-L1, or CTLA-4 inhibitors, okay? These are drugs. These are IV drugs, intravenous drugs for the most part, that you inject into a patient, and that drug basically turbocharges your body's own immune system to start recognizing the cancer, and the body's immune system attacks it, okay? So that's the earlier generation of drugs. And that has been completely revolutionized oncology, and certain types of cancers which were previously incurable are now curable, even if it's stage 4. We've seen patients who can be cured with if they happen to have the right, if the tumor happens to be sensitive to these checkpoint inhibitors, that could be a huge game changer for that individual patient. But it also doesn't work for many other patients. And we're trying to understand why. Why does not everybody's body's immune system get turbocharged? Why are we not having 100% cure rates in everyone? And the answer is it's pretty complex. This new drug, which my colleague, Dr. Sandra D'Angelo, helped lead and has been working on it for the last 15 years, relentlessly, and just recently approved by the FDA, is a different concept. It's trying to fill some of those gaps that the checkpoint blockade itself does not address. And the difference is the following. With checkpoint blockade, you need to give the drug again and again and again and again. Every month, every 2 months, you need to go and get these drugs. These are intravenous drugs. What these T-cell therapies do is you take, from your blood, you draw out the body's immune system, you isolate a certain type of cells called T-cells. These T-cells are the ones that fight cancer. Mm. And the question is, why are they not fighting this cancer? How come it's not doing its job? So we take it out, send it to a factory, re-engineer it using viruses and other ways to make it now recognize the cancer. You teach them how to fight cancer in a very unique, that particular cancer, not any random cancer. Those T cells are taught to fight only that cancer that's existent. And you infuse it back, and you only have to do it once.
As insightful as this conversation is, of course, it has to end at some point. Now, talking about, what I want to end it with is, because we're talking about drugs, we're talking about new drugs that can, help treat not just sarcoma, but like cancers in general. A lot of people I've heard from, a lot of patients I've interviewed, a lot of cases I've seen in my family as well. Cancer is something that never goes away, right? There's some sort of thing, like even if the cancer is completely gone, maybe it could be recurring. Maybe the drug is the medicine you're taking is so heavy on your body that something else happens. Then what is the process after, let's say, you have been diagnosed, you have been treated, you've gone through therapy? What next then?
Yeah, that's a huge question. I'm glad you brought that up. So that really comes down to the question of survivorship, right? So these are people who have beat cancer physically, but the emotional toll has not been fully processed. They're living with this, and it has huge ramifications for the rest of their lives, right? So I have young people who have now, quote, beat cancer, and now they are grappling with, should I go back to work? Mm-hmm. Should I start dating again? Can I get married? When should I tell someone that I previously had cancer? Is it ever going to come back? You wake up in the morning, you have an ache in your back. The first thought that comes to you is, oh God, I hope it's not the cancer coming back. This is a big problem. And that's why, at least here at Sloan Kettering, and not just us, but many cancer centers in the US have really started focusing on something called AYA, or adolescent and young adult survivorship programs. And there are survivorship programs that have been around in breast cancer, ovary cancer, and many other cancers. But that's where survivorship programs really help. They help you connect with other people with whom you can process the emotional. Most of the time, the emotions are not really processed at all. You get diagnosed with cancer, you're always in a let's go to the doctor, let's do chemo, let's do surgery, let's do radiation. It's exhausting. And all of that, the underlying fear, not just of the patient, but the parent, your spouse, your sibling, your family members and your friends, those all get neglected. Those all get suppressed and put down and never fully addressed. After all of this is done, we still need to we need to process all of those things. And that takes months, years to process. And there are many different ways. I mean, and I think survivorship programs where women with breast cancer who beat breast cancer are now able to get together with a community and talk about their individual fears, or young people who have beat something are now cured, still need to connect in an authentic and a genuine way about their fears and what to do moving forward. And that's a huge thing. You're correct. There's a lot of new drugs, and I do believe in my heart that in the 21st century, we are going to beat cancer. It is going to be cured, or it's going to become a chronic illness, no different than diabetes or hypertension. I am convinced of that, because the speed at which science is moving is extraordinary. Whether you're in India or the US, we need to talk about this openly with no shame. That's the number one thing. We have to talk about this with no shame, saying that this is because your astrological stars were XYZ and that's why you got it. We have to move away from those things and say, look, I got cancer. And believe it or not, the moment you say it, somebody else will say, guess what? I also have it. And you form community. This is how you build patient advocacy. This is how you beat cancer. It's not just through drugs. It's not just through screening. It's a bigger web of dealing with this.
Right. Yeah. Makes sense. And I think it's important that we talk about survivorship. And that's right. Like after everything that's done, it's the community that helps each other. And I think you were also that is, it brings us to the first point that health advocacy groups.
Yeah.
That is where it really sort of helps people go forward and move forward with life. Yeah.
Yes, absolutely. Absolutely.
Yeah.
Best of
Uh,
luck with your journalism. Really, really appreciate people like you bringing attention to rare cancers, rare diseases, and overall elevating the health of the nation.